The main character of the film is John Nash, a mathematical genius, and the movie mostly focuses on his schizophrenia and the damage that it causes in his relationships and his life in general. Through his time at Princeton University and MIT, he develops multiple hallucinations and is eventually taken to a psychiatric facility where he undergoes insulin shock therapy. And after he notices the harm that his hallucinations and behaviors have on his family and his wife, he consciously begins to dismiss his hallucinations and is eventually awarded the Nobel Prize in economics.
So the main disorder covered in the movie is paranoid schizophrenia, and John Nash suffers this by having hallucinations of his roommate Charles, his roommate's niece Marcy, and Agent Parcher, who is a part of his delusion that the Russian government is trying to kill him, and he can see and crack codes that are not actually there in newspapers. Um, he has impaired speech that eventually severely impairs his relationship with his wife, and he shows negative symptoms in his apathy, his loss for sexual drive, and his loss of emotional attachment. The main treatment depicted in the film is insulin shock therapy. However, it is no longer an ethical practice. The main treatment for schizophrenia is now antipsychotics. Chlorpromazine, which was initially used to treat agitation, but schizophrenic patients started to show decrease in hallucinations and delusions. Therefore, it became the main medication to treat schizophrenia.
I thought that the depiction of schizophrenia in the film was a little bit different than what I learned doing my research, because if a schizophrenic has hallucinations, they're more than likely going to be auditory, not visual, as portrayed in the film, but it did seem to accurately portray the damage and the hardships that a person with schizophrenia goes through and how they cope with it in their day-to-day life.
And going back to the antipsychotic drugs in the film, John Nash reportedly did not take medications after getting out of the hospital, but the film did encourage sneaking away the medication, so it was a very big issue in the film.
There are both serious and humorous scenes in the movie. John Nash liked to tell jokes about his hallucinations and um, make light of his situation, but there was serious matter in the fact that his symptoms impaired his marriage and his relationship with his son. From the film, I learned more about the physical symptoms of the disorder than I had previously known.
Yes, and the film also did cover a lot about what the textbook says about a person diagnosed with schizophrenia, including all of the negative and positive symptoms.
The film holds educational value to the public because it shows the intensity of the symptoms, the hallucinations, delusions, and their effects on the individual.
And also the fact that only 1% of the population is actually affected by schizophrenia. This gives an opportunity for the other 99% of the population to be informed about the symptoms of schizophrenia.
I enjoyed the suspense of the film, and it was intriguing to me because I realized that even if you're very close to a person, you may not know that they have a disorder.
And apart from the psychological aspects of the film, it was very emotional to me in the way that uh, his John Nash's wife developed a relationship with him, even though he has schizophrenia.
I would recommend the film because of the moving content and the accurate depictions of the symptoms of schizophrenia.
Yes, and it is also a film that covers every aspect, including emotional, psychological, and physical aspects of a schizophrenic person.
Our film recommendation is No Country for Old Men, and we are suggesting it because we think it's an accurate portrayal of a psychopath because of the antisocial personality disorder that it discusses and the symptoms of having no remorse for killing somebody and harming others.